everyone. There can be a lot of steps in understanding what is causing your symptoms. Today we are talking about what you can do next. A great start is to take the Better You Know risk assessment tool if you haven't already. It's important to remember that this screening tool is a risk assessment and does not give a diagnosis. Nope, that is not possible online. But it is super helpful to give you some additional information that you can then take to a doctor to discuss your symptoms. Plus, it is a validated tool, which is a fancy way of saying some doctors researched its use to make sure the tool works correctly. Doctors love validated tools. Another important early step is to schedule an appointment to talk to a doctor about your symptoms. If your main symptom is heavy menstrual bleeding, we recommend that you make an appointment with your gynecologist. If your main symptom is heavy bleeding after surgery or a procedure, frequent nosebleeds, or easy bruising, then you likely want to schedule the appointment with your general practitioner. It is important you see your general healthcare provider or your gynecologist to talk about what may be causing your symptoms. If they believe you may have a bleeding disorder, they will refer you to a hematologist, which is a specialist who diagnoses and treats individuals who were born with bleeding disorders. The hematologist will also want to run different laboratory tests to determine if you have a bleeding disorder, and if you do, which bleeding disorder you have. This process can take a while to get appointments scheduled and get laboratory results back. Be patient, because these steps are worth it. And it is important to get started now. You have symptoms of a bleeding disorder. Even if the cause is not a bleeding disorder, there are a lot of resources here at betteryouknow.org that can help you work with your provider to understand the reason you are experiencing these symptoms. Congratulations! You just took the first steps towards seeking out a bleeding disorder diagnosis.